Hello and welcome to OT Conversations. In this episode, I talk to Kim, who is an OT student who is having her placement with us. In our session, we looked at the 4 facets of clinical reasoning and we tried to apply these facets in situations that Kim encounters. If you are new to this podcast, please click subscribe and share so that we can pass on the benefits to other OT students, to new clinicians, or for those seasoned colleagues who want to refresh on relevant information involving occupational therapy. I hope that after listening to this episode, you'll be familiar with the 4 facets of clinical reasoning and that you can start thinking about these when you are looking after your patients. Enjoy! This time we'd like to talk about clinical reasoning.
Okay.
Yeah?
Mm-hmm.
How do you clinically reason?
Do you want me to start?
Yeah. Oh, yeah.
Yeah. I'll just start with an example. I've got like 2 examples. Like when we went to go and see a patient with Eloise, he was saying he's got diarrhea.
Mm-hmm.
And he's worried like if he goes home, he won't be able to get up on time before the carer comes to help him.
Mm-hmm.
So I'll be like, okay, that was where the clinical reasoning came from. Like, what can you do in order for him not to kind of like mess himself up?
Mm-hmm.
Pads. I'm just, for example, like.
So when you wear pads, what is that?
To prevent accidents.
Preventative intervention.
Yeah, preventative, yeah.
Good.
And it's just going to be for like short time,
Mm-hmm.
pending when the carers can come to get him up and help him with the necessary things. And the second one was, okay, after that one, during the day, it's going to be on the chair. So it can easily go up, get up to go to the toilet. You need to look at the distance from where his toilet is and where he's going to be in his lounge. So the only thing you can do in order for him to be able to get to toilet on time, microenvironments, having his commode closer to him so that he'll be able to get on the commode on time.
Yeah.
So I'll be like, that's my example, like clinical reasoning. And the second one is, I'm going to use my daughter again.
Okay.
When I have an OT, we're thinking, I didn't even know any condition called picker. Because we're thinking, why is she putting a lot of things in her mouth? What can be the cause? It was an OT that said, refer her to the doctor to do blood tests to see if there's anything wrong, like iron level. Why is she craving for like unnecessary things? So I'll be like, that's an example of clinical reasoning as well. So it's like when you see things, you try to like, what can be wrong? What solution? What can I do in this kind of situation?
Yeah.
That's where our clinical reasoning comes from. And whatever we do as an OT, we make use of our clinical reasoning, our skills,
Yes.
to kind of find solution to that problem. Even if you can't find like the final solution, but there will still be something in place that we can actually do. So I think I'm just like, if I'm right, like whatever you do, your clinical reasonings, the decision you make, you need to think of it like, am I making the right decision? Is it the right thing? And we can't know it. So if you're not sure, like, okay, this is going to work, that's where you can ask your colleagues to like, okay, this, like to think. I'm just like, so.
Yeah. So yes, that's very true. You are reasoning. You're clinically reasoning things up. Because at the end of the day, it's all about how do you resolve the problems, isn't it? So there is a problem. How do you want to resolve it? So clinical reasoning at the end of the day is how and what would make you a good student and what would make you a good educator and a good teacher. Because you're by reasoning, it means that you're able to verbalize your process. Yeah, of how you ended up making that decision. Okay, and there are facets of clinical reasoning. Have you come across this? Has this been discussed in the university? No. Okay, probably not. Probably yes, probably not. They'd always do that, but we want to use it in practice. Yeah. So while you're here doing your placement,
I think that's why they say evidence-based.
That's what they would say. You want it to be evidence-based. Yeah. That's yeah. So therefore, you make decisions based on these four facets of clinical reasoning. So the first part of the clinical reasoning is the scientific reasoning.
Okay.
Yeah. So what are the scientific merits of the situation? Yeah. So this would be the medical condition, anything that has to do with science. What's their medical condition? What's
Okay.
their medication? What's the nature of the condition?
The past history.
What's their past history? That's the medical situation, isn't it? The one that you quoted earlier on, Parkinson's disease.
Disease.
What is the nature of Parkinson's disease? What are the symptoms of Parkinson's disease? Isn't it?
Yeah.
You have bradykinesia, you have intention tremor, you have postural instability, yeah. And Parkinson's disease is also very much reactive and very much time dependent, time reliant in terms of medication.
Medication.
How far is the person down the condition?
This stage.
Parkinson's disease is a deteriorating condition. Isn't it?
Yeah.
So that's that. So that's the scientific merits of the case. Yeah. In a case here where you are with me in critical care would be,
Different things.
after the operation, these are the processes that they needed to be in. They're not breathing in properly. You need ventilators, and then the ventilators, these are the limitations. Person is on ionotropes, meaning they have medications that is, like supporting the blood pressure and the rate and the rhythm of the heart. Or the scientific would be those bivads, isn't it? The nature of those conditions, they have an influence. Yeah. On the things that you would do. Scientific merits. The second part
is I just want to link it to, before you go to a patient to go and do anything, you check their OBS, like if
the OBS would have a factor, because if the blood pressure is high or low, then you cannot do your intervention, isn't it?
Yeah.
If I say, why didn't you do your intervention? Well, because I'm reasoning. My reasoning is that it's limited by that immediate vital signs, isn't it?
Yeah.
So that's influencing your intervention, isn't it? Say you're planning to do restorative intervention, washing and dressing, and yet there is the blood pressure does not allow it, then you cannot do it. So that's it. That's why you can't do it. So scientific measures. The next part of scientific reason, the next part of the facet of clinical reasoning is the narrative reasoning, meaning what is the life story
of that person,
of the person, isn't it? It will have an influence on what you do, on your decision, yeah, and you'll have to weigh your decision making based on what they value, based on what they like.
That's
based on the challenges.
Initial assessments to find out.
Yes, you do the initial assessment because you want to find out who's this person. What is important to them. Yeah, as an occupational therapist, you wanted to know the person. You're not just looking at the medical condition. Part. Yeah, it has a major impact on what we do as therapists. Okay. So that is the second part of the facets of clinical reasoning, which is narrative. The third facet of clinical reasoning is called the pragmatic clinical reasoning.
I think I've heard pragmatic, but I can't
pragmatic meaning the practical nature of things.
Okay.
The limitation of what you can do. Like, for example, yes.
For example, like people that we just saw now, they wear a lot of attachments. You can't do anything with them.
Yeah.
Am I right?
Yeah.
So, like, this is limiting them.
Yeah.
Like, to do anything, like, practically, like,
yeah.
I'll be like, for example, ADL, you can't, because that one's like, you can't do because they've got things limiting them from there. Am I right?
The pragmatic aspect, I think, when they're connected to those a lot of things, I'd say it's more because of the scientific reasons.
Okay, all right.
Isn't it? Because there's still medical going on. So they're still connected to a lot of things. So it's the scientific
Let me try
limits.
again.
Okay.
Environments.
Yeah.
Maybe someone that's got like, some like odors, that house is full with things.
Yeah.
So practically, like, you can't really do anything because there's like an obstacle
Yes.
stopping you from doing it.
Yes.
So before you can do anything like with them, that needs to be clear.
Exactly.
Is that?
Yes, that's one example. Yeah, yeah. So a pragmatic are the practical limitations, and practical limitations can be because of the rules and regulations.
Okay.
Like, for example, like if you're in a heart hospital, like now, for example, you're in a heart hospital, and everything else about the heart is sorted out, but the person is
It's still not.
is not ready to go from a heart perspective, but then they're not yet functionally ready to go. Knowing that you're in a heart hospital where the hospital needs to do its job of looking after the heart, you cannot keep the person in the hospital any longer than you wanted to. So you need to make a recommendation for this person to go to either district general hospital or a rehab facility.
Oh yeah, or
repatriation.
Yeah.
Because of the practical nature that you're not and you cannot do it because the rules dictate that your scope of practice is dictated by this.
Or IPR. IPR,
inpatient rehab. Yeah. So that's right. Yeah. So that's the practical nature of things. The Like, for example, if you're working in a hospital and the person needs a wheelchair, you cannot make a referral to wheelchair services to wait for the wheelchair to come in because it'll take a long time. So what you do is you give a patient information so that they contact
like a leaflet where they can get
a Red Cross.
Yeah, Red Cross, yeah.
So that they can have immediate access to it. So you see, your decision making was then influenced by the practical limitations. Yeah. So that's the pragmatic reasoning. Yeah.
Okay.
And then the last part of reasoning is called ethical reasoning. Yeah. You would do things or would not do things because it's the ethical
policy and procedures.
Like, for example, if you are with somebody who refuses therapy,
yeah,
so they need to do washing and dressing, and they don't want to do it with you.
Okay.
Yeah, they're refusing to do it with you. I mean, there are two things that dictates this. One, narrative, they don't want to.
They don't want to.
Yeah. Are you going to insist?
No, they've got it's that choice, isn't it? You can't force it on them.
Would you insist?
No, you can only try, but you can't insist.
Why?
No. Because they've got choice.
And it's unethical to do so.
Yeah, it's unethical. It's against the job.
Exactly.
Yeah, because they've got, that's where the mental health, they've got capacity to make decisions themselves.
Yeah.
Yeah.
It is unethical because if you do that, if you impose a treatment on somebody who doesn't want to, it's an assault.
It's an assault, yeah.
Isn't it? So there we go. So that's the ethical merits of the case. Are you going to do washing and dressing practice on somebody who's dying?
No.
Well, there are two things in there. One, scientifically, the narrative is influencing that. And is it ethical to do that?
No.
No, isn't it? So those are the very straightforward, really, 4 things that you would consider.
Clinical
reasoning. To make your clinical reasoning. So when you're resolving problems, I think you got it right. With your example the first time, that was good. I can't remember what you quoted. Oh yes, an example of a Parkinson's disease.
Yeah.
Who has where your decision was to get them to have a pad, and then the person to come down and then have a micro environment. And I think the reason why you did those decision is because of, one, you acknowledge the scientific nature of the condition. Yeah. Two, you want the person to be as independent as possible, which is the narrative side of things. Are you going to rehabilitate them? No, there's no potential, because again, scientific, you can't address that. You can't change that. So your intervention then became modify intervention or even preventative intervention. Yeah. Do you want to keep the person in the hospital for as long as you needed? No, you want to facilitate them going out. Why? Because of the pragmatic nature that you're in a specialist heart and lung facility, for example. And did you see the person as soon as possible? Yes, because you have ethical commitment to do so, isn't it?
Yeah.
There you go. So I think what you've got the reasoning. I'm just putting a label on where you are basing your reasoning.
Yeah.
So that anytime and anywhere, wherever you go, you'll have that with you. There you go. Really, there you go. Those are the facets of clinical reasoning. And the more you practice, the more you verbalize this, the more you will be, you'll just, sail through your placement, and you can pass this on to your students.
My students.
Your students, and when you become a therapist yourself. And if your supervisor in the future asks you about it, you have a sound foundation where you're basing your reasoning. Because I've worked with some people before. Their reasoning is, they have reasoning, but they don't know where they're basing it on. So I could never win against them. You can never win an argument because you don't know where they're coming from, isn't it?
Yeah.
Whereas with this, where you know where you're coming from, then every decision will fall on the same decision, the same line of action, and it'll make clinician's decision reliable, meaning what you decide on, what I decide on will be the same if we factor all those four aspects. Okay?
Yeah.
All right. If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. I am but your humble clinician, albeit with years of experience. I have very little understanding of this digital world. So if you have any questions, or if you have topics that you want me to talk about, drop me an email. It's riot.conversations@gmail.com. Just remember, guys, anything you do matters and has an outcome. Until next time, bye.